Hello, my dear friends and colleagues. My name is Tyler Middlebrooks, and I'm a Nuclear Medicine Technologist 4 and Image Quality Assurance Officer at Carti Cancer Center in Little Rock, Arkansas, USA. I have spent the last decade with Carti fighting cancer, specializing in imaging and treatments. Also, I work for medical imaging consultants as a health physicist, testing all types of radiology equipment. I authored PETCT artifacts and pitfalls. In this chapter, we review different artifacts in PET and CT, how to identify them, how to prevent them, and novelties that can be used to prevent these artifacts. Artifacts are routinely seen in all radiology modalities in different ways and degrees. Here are a couple artifacts seen in CT. All modalities must overcome an inherent noise to ensure the signal-to-noise ratio is acceptable. The first CT artifact I would like to talk about is a helical artifact. Due to the advancements in CT over the past years, volume acquisitions are essential. Helical artifacts are caused by rapid movement during the scan acquisition. This occurs when the scanned anatomy changes position during the acquisition, which causes the reconstruction algorithm to interpolate the data. This is mostly seen in the lungs and liver due to the patient's breathing during acquisition. It typically appears as a spiraling appearance, causing low Hounsfield units on the CT images. Again, this is routinely seen in the lung base due to breathing during the CT exam. To prevent this, the technologist should instruct the patient to take shallow breaths throughout the exam and withhold from deep breathing unless instructed per the exam protocol. Technical novelties that may be used are an abdominal strap to prevent deep inspiration, and this will also assist in reduction of movement. Metal artifacts are one of the most frequent seen artifacts on CT exams. When a patient has an internal metallic implant, many different artifacts can occur. The bright white streaks appearing around the metallic implant are metal artifact and quantum model. The dark area displayed is beam hardening and scatter effect. It is particularly important to remove all metallic objects from the scan field of view to reduce metal artifact and to improve overall image quality. If you look at figure 2 here, this is a CT scan through the hip. Image A, there's bright streaks near the hip replacement, most likely due to beam hardening and scatter without artifact reduction. Image B, artifact reduction is turned on. Image clearly shows swelling and inflammation around the hip. C is a coronal image of the hip replacement with metal artifact turned on. These artifacts are caused by dense metallic objects being inside the scan field of view. We can prevent this is to remove all the metallic objects from the scan field of view if possible. Technical novelties that may be used is metal artifact reduction software. In my opinion, most of these do a great job and improve image quality. Next are motion artifacts seen on CT. There's another extremely common artifact you can come across. Motion artifacts are typically caused by movement of the heart, bowels, lung, voluntary or involuntary movements. The image appears to have a doubled exposure or blurred look with long streaks along contrasted edges. If you look here at figure 3, this is a motion artifact. Image A, appropriate breath hold during CT acquisition. Image B, breathing during acquisition causing doubled imaging, blurred, and image quality loss. Again, if you look at image A, the edges are well defined, and B, all the edges are ill-defined due to breathing or motion artifact. A method to reduce image motion, if the patient is unable to remain still, is to scan faster, giving the patient less time to move during the exam. This can be achieved by increasing the tube rotation, increasing the table speed, or increasing rows of detectors to allow for volume scanning. Again, motion artifacts are caused by movement during the CT exam due to voluntary or involuntary movement. It appears as blurred or doubled images and may have a streaky appearance. The best way to prevent motion is to have the technologist explain the importance of remaining still during the exam and, if needed, increase rotation time, table speed, and or acquire volume data set if the patient is unable to remain still during the exam. Technical novelties that may help reduce motion are the use of straps and stabilization techniques to help the patient remain still during the exam. Also, the use of cardiac and pulmonary gating has shown to be extremely helpful in improving temporal resolution. Noise, or quantum model, is due to the statistical error of low photon counts in an image. This can appear as random dark or bright areas of an image. Increased noise in an image that with high contrast will still have good image quality, like bones, but low contrast objects such as soft tissue will start to lose resolution and the edges will start becoming ill-defined. We can reduce noise by increasing the technique, electrical current or MA of the exam. Also, we can decrease the rotation time. Technical novelties include iterative reconstruction, filtered back projection, and other noise reduction software can assist in the dose reduction without increasing the patient's dose. Out of field of view artifacts are typically caused by a suboptimal reconstruction algorithm, is caused by an object being outside of the scan field of view. A small field of view is a great way to reduce the radiation burden to your patient. If the sinogram edges are set to stretch to the end values, the out of field of view artifact will be greatly eliminated. If you look here, figure 4, this is an out of field of view artifact. Image A, artifact near the right iliac crest, there's bright areas. Image B, artifact of the same patient near the right shoulder. And this is mainly due to the patient not being properly isocentered and the sinogram edges not stretching to the end values. Ways to prevent out of field of view artifacts are to align the patient so that all anatomy is inside the scan field of view, or adjust or optimize the reconstruction algorithm. Technical novelties that can be used as straps to narrow the patient can help the patient remain inside of the scan field of view. The addition of software reconstruction algorithms can decrease the out of field of view artifacts in large patients. The last CT artifact we will review are ring artifacts. Ring artifact is caused by a miscalibrated or defective detector element, which results in rings or an appearance of a water ripple effect on the image. This can often be fixed by recalibrating the detector. A miscalibrated or defective detector element creates a bright or dark ring in the center of the field of rotation. This is sometimes can mimic pathology. Figure 5, there is a faint ring artifact seen in this CT chest without. If you look right in the center of the image, you see that water ripple or almost bullseye effect. And if you look where the red arrow is, you see the faint ring artifact that appears as a dark edge circling the center. Prevention is done through daily phantom and QA checks along with routine preventative maintenance. PET artifacts. This section will discuss and illustrate artifacts that can be seen during the PET portion of the PET-CT exam and review ways to reduce or eliminate these artifacts. Over the past years, the use and combination of PET-CT imaging has grown exponentially, and that it will be I believe it will be a large component in radiology in the future. Contrast media and metallic artifacts. Intravenous or oral contrast media can negatively affect image quality. Administration of contrast media can alter the quantitative and qualitative accuracy of the PET images, like metallic implants on CT imaging. These areas of high density caused by contrast media will artificially increase the SUV or standard uptake value in these areas, causing a false positive result. The severity or degree of misinterpretation is dependent on the concentration of contrast in this area. If you look here, figure 6, this is a patient who ingested barium for an esophagram 1 day before the PET-CT scan. Concentration of contrast media is seen in the colon in figure A. Figure B, high CT numbers in the residual barium overcorrect for increased PET value, SUV. Image C, this is the non-attenuated corrected, very low amounts of uptake seen. Ways to prevent artifact are to avoid the use of contrast during the exam or after a contrasted exam. Perform a CT with and then without contrast media. Increased radiation exposure should be evaluated if the benefits outweigh the risk. Technical novelties that may help are the use of metal subtraction software that have been shown to reduce artifact caused by high-density contrast media in PET-CT imaging. Noise. Image noise relating to PET imaging is remarkably similar to the noise sometimes found in CT. Noise is a statistical error of low photon counts in an image, which can appear as random dark or bright areas. Typically, noise in nuclear medicine exams are due to low count rates. However, noise in PET imaging is not related to the CT quality. This can be due to different reasons, but like low radiotracer activity, reduced acquisition time per PET bed, or maybe inherent noise caused by image resolution of your equipment itself. If you look here, figure 7, image A, this is showing increased noise due to suboptimal scan times. And if you look at image B, noise reduction with adequate exam time given the scanner time to acquire the appropriate number of counts to not demonstrate noise. Image A is retrospectively reconstructed with 66% decreased scan time to demonstrate image noise. The best way to improve noise on the PET portion of the exam is to ensure the exam acquisition time per bed is appropriate with the given activity. Technical novelties used to improve image quality are noise reduction or image enhancement software can be used to decrease noise and increase edge enhancement without increasing the dose to the patient. Respiratory motion artifact. Respiratory motion is another one of the most frequent artifacts seen in PET-CT imaging. Due to the long acquisition time, the acquired images are representative of several breathing cycles. In addition, some patients, without being told, will hold their breathing or suspend breathing during the CT portion of the exam, thus causing an increased misalignment near the diaphragm. If you look at figure 8 here, this shows respiratory motion at the level of the diaphragm. Due to breathing or withhold breathing, this shows misalignment of the diaphragm, causing a low count rate area seen at the red arrow there. The best way to improve or reduce breathing artifact are to instruct the patients to take shallow breaths during the entire exam. Technical novelties include the use of respiratory gating, and shallow breathing has shown to dramatically increase the exam quality throughout the lungs while increasing sensitivity at the same time. Injection site artifact. Vascular access is a particularly important step to secure prior to injection. In some cases, proper vascular access is not obtained, and a portion of the injection is infiltrated. In most cases, this is not severe enough to repeat the exam, but it can range in severity, resulting in a non-diagnostic to a diagnostic exam. If you look here, figure 9, this shows a MIP image with a infiltration artifact in the left hand. Image B is the same thing, but you can see in the left hand, a portion of the radiotracer is infiltrated outside of the venous system, and you can see it accumulating in the hand and forearm. Ways to prevent this artifact is to ensure free-flowing vascular access prior to administration. A technical novelty, if infiltration is suspected, it is to increase the counts collected, or, if applicable, use a scanner that has the highest crystal efficiency. The last PET artifact that I'll discuss is truncation. In PET-CT imaging, truncation is possible when the CT field of view and the PET field of view are different. If anatomy is outside of the CT field of view, then truncation can occur, causing incorrect AC data. It is best practice for the technologist to position the patient in the ISO center of the scanner with their arms above their head to reduce the possibility of truncating the truncation artifact. If you see figure 10 here, A, this is a transverse or axial fused image showing truncation. The patient is outside of the CT field of view with attenuated correcting images expanding outside of the CT image. This area is not represented in the CT reconstruction and has no attenuation correction values for the corresponding region. Look over to the right, image B, this is sagittal fused image showing truncation. And if you look there at the red arrow, you can see where the CT images stop and the PET or AC data continues. This data out here does not have any attenuated corrected image value, and you need to be aware of that. The best way to prevent truncation is to ensure that all of the patient anatomy is inside both fields of view when possible. Technical novelties that may increase image quality is to optimize reconstruction fields to use different sizes can better display anatomy on both CT and PET. When possible, use the smallest field of view for both CT and PET, matching in diameter and including all anatomy. Interpretation pitfalls. PET-CT imaging is a combination of diagnostic procedures, making it difficult to interpret with artifacts and pitfalls often seen. And extensive knowledge of physiology variation, normal distribution are a must for technologists and radiologists. It is essential for the technologist to be aware of importance of patient preparation, administration, and acquisition to ensure the highest quality exam. With suboptimal technologist practices, interpreting these exams can become very difficult and may lead to misdiagnosis. Movement during the acquisition can be detrimental to the exam quality. The arms are routinely placed over the patient's head, causing a common location for movement artifact along the arms and head. In whole body imaging, patients' arms are down by their sides, but they periodically move during acquisition. This artifact manifests due to an underestimation of the radiotracer concentration that became more significant with increased misalignment and can cause streaking cold artifacts in the PET images. Reconstruction artifacts due to the patient's arm motion can be substantial and should be recognized because they can both affect the quantitative and qualitative assessment of the PET imaging. PET-CT imaging is a complex modality with complicated systems in which all need to work together for a clear diagnostic result. Technologists are responsible to ensure exam accuracy and validity. PET-CT exams are routinely used to diagnose, stage, and restage oncological, neurological, and cardiological diseases. Knowledgeable and diligent technologists can minimize artifact and other potential problems with image acquisition, and in that way produce a better quality PET image. I have really enjoyed the opportunity to assist my fellow technologists and hope you find this helpful addition to the Technologist Guide. I hope this book deems not only to assist nuclear medicine technologists in their clinical rotation, but also a wide range of professionals working in the field of nuclear medicine. I'd like to thank the European Association of Nuclear Medicine and for allowing me to participate in this publication. Also, I'd like to thank the Society of Nuclear Medicine and Molecular Imaging. Thank you, guys.